Stop everything you are doing right now. If you or someone you love has ever seen the numbers 180 over 120 on a blood pressure monitor, or if you have ever felt a sudden pounding in your head, a tightness in your chest, or a strange blurring in your vision, what I am about to tell you in the next few minutes could be the most important thing you hear today. Not tomorrow, not next week, today. Because 180 over 120 is not just a high blood pressure reading, it is a medical emergency. And the difference between what you do in the next few minutes and what you don't do could be the difference between walking out of your house tomorrow morning or not. My name is Dr. Carme William. I'm a cardiovascular physician, and I have spent over 20 years working with patients who have hypertension, high blood pressure, and the devastating consequences that come when it is not managed correctly. Today I need to talk to you about something that happens every single day in homes around the world, to people who had no idea they were in danger. And I need to talk to you specifically, the seniors watching this, because the risk is real, it is serious, and most people are completely unprepared for the moment it arrives. Let me tell you about a woman named Gloria. She was 71 years old. She lived alone, had mild hypertension that her doctor monitored, took her blood pressure medication most of the time. But like many people, she sometimes forgot a dose or two. She was not a dramatic person. She did not panic easily. One evening she was sitting in her armchair watching television when she noticed a strange throbbing at the back of her head. She also noticed that the television looked slightly blurry. Her heart felt heavy and fast. She picked up her blood pressure monitor. She had one at home, thank goodness, and the numbers that appeared made her hand shake. 186 over 124. She sat very still for a moment, and then, and this is the part that matters, she knew what to do, because someone had told her, and tonight I am going to be that person for you. First, I need you to understand what is happening inside the body when blood pressure reaches 180 over 120. Because understanding this is not just academic knowledge, it is the kind of knowledge that changes how seriously you take the situation. Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps it through your body. A normal blood pressure is around 120 over 80. At 140 over 90, we call it hypertension, high blood pressure. But at 180 over 120, we are no longer talking about hypertension. We are talking about what cardiologists and emergency physicians call a hypertensive crisis. And there are two types. The first is a hypertensive urgency, where the pressure is dangerously high but there are no immediate signs of organ damage. The second, far more dangerous, is a hypertensive emergency, where that extreme pressure is already actively damaging the brain, the heart, the kidneys, or the eyes in real time. The frightening truth is that from the outside, it is often impossible to tell which one you are experiencing without medical evaluation, which is exactly why the numbers 180 over 120 must always be taken seriously. What does extreme blood pressure actually do to the body? Imagine your arteries as flexible garden hoses. At normal pressure, water flows smoothly through them. Now imagine doubling or tripling the pressure inside that hose. The walls begin to strain. They can bulge. In the worst cases, they can rupture. In the brain, a rupture means a hemorrhagic stroke, bleeding inside the brain. This type of stroke can cause permanent paralysis, loss of speech, loss of vision, or death within minutes to hours. In the heart, extreme pressure can cause the heart muscle to struggle and fail, triggering a heart attack or acute heart failure. In the kidneys, sustained extreme pressure can destroy the tiny filtering vessels, causing acute kidney damage. In the eyes, it can rupture the small blood vessels of the retina, causing sudden vision loss. All of these are happening, or beginning to happen, when that monitor reads 180 over 120. And none of them announce themselves loudly. Many people feel surprisingly little, a headache, perhaps, or some dizziness, while inside, irreversible damage is quietly unfolding. So what do you do right now, in the moment? What are the immediate steps that Dr. Kame William wants every senior watching this to know and to have memorized before they ever need them? The very first thing, and I cannot say this clearly enough, is this. If you measure 180 over 120 and you have any of the following symptoms, you must call emergency services immediately and not wait. The symptoms that mean you need an ambulance right now are chest pain or pressure, shortness of breath, severe headache that came on suddenly and feels different from any headache you have had before, sudden confusion or difficulty speaking or understanding speech, sudden numbness or weakness in the face, arm or leg, especially on one side of the body, sudden vision problems in one or both eyes, sudden severe dizziness or loss of balance, or nausea and vomiting alongside the high reading. Any one of these alongside 180 over 120 is a hypertensive emergency. Do not drive yourself. Do not wait to see if it gets better. Call the ambulance, lie down, unlock your front door if you live alone so emergency services can enter. This is not being dramatic. This is being alive tomorrow. Now, what if you measure 180 over 120 and you have none of those symptoms? You feel a headache, perhaps some pressure in the head, but you are conscious. You can speak clearly. Your vision is intact. You have no chest pain, no weakness on one side. This may be a hypertensive urgency rather than an emergency. And here is what Dr. Kame William wants you to do in those minutes while you assess the situation and decide whether to call for help. The first thing is to sit down. Immediately. Sit in a chair with your back supported, your feet flat on the floor, your arms resting. Do not stand. Do not pace. Do not rush to the phone in a panic. Sit. The act of sitting quietly and removing physical exertion from the equation can in itself begin to reduce blood pressure slightly. Your body needs stillness right now. The second thing to do is breathe. And I mean breathe deliberately and specifically. There is a breathing technique that has been studied in multiple clinical settings and shown to produce genuine, measurable reductions in blood pressure within minutes. It is called slow-paced breathing or resonance breathing. You breathe in slowly through your nose for a count of 5. You breathe out slowly through your mouth for a count of 5. You do this continuously for 5 to 10 minutes. This activates your parasympathetic nervous system, the opposite of the fight-or-flight response, which directly signals your blood vessels to relax, your heart rate to slow, and your blood pressure to begin reducing. A study published in the journal Hypertension found that just 5 minutes of slow-paced breathing at 6 breaths per minute produced statistically significant reductions in blood pressure in hypertensive patients. It is not a cure, it is not a replacement for medical treatment, but in the moment when you are waiting for help or monitoring the situation, it is one of the most powerful things you can do with your own body to help reduce the immediate risk. The third immediate action, if you normally take blood pressure medication and you missed a dose and your doctor has previously discussed this situation with you, take your medication. I want to be very careful here. Do not take extra medication beyond your prescribed dose, thinking it will bring the pressure down faster. This is dangerous. Do not take someone else's blood pressure medication. Only take your own prescribed medication at your normal prescribed dose, if you have missed one and your doctor has told you what to do in this situation. If you are unsure, call your doctor or a nurse helpline immediately. If you take nitroglycerin for a heart condition and have been prescribed it for exactly these moments, follow your doctor's instructions for its use. The fourth thing is to call someone. Even if you are not calling an ambulance, do not be alone with a reading of 180 over 120. Call a family member, call a neighbour, call your doctor's emergency line. Tell someone where you are and what your reading is, because the situation can change rapidly, and you do not want to be unconscious and alone when it does. The fifth thing, and this is important and almost nobody mentions it, avoid the things that will make it worse. Right now, do not drink coffee or any caffeinated drink. Do not smoke. Do not eat a large heavy meal. Do not engage in any physical activity. Do not watch stressful news or have an emotionally charged conversation. Do not take cold or decongestant medications. Many of them contain pseudoephedrine, which can dramatically raise blood pressure. Remove every possible stimulus and stressor from your environment. Quiet room, sitting position, slow breathing, someone who knows where you are. Now I want to speak directly to the seniors watching this, and I want to say something that I say to my patients with absolute sincerity. High blood pressure in people over 60 is extraordinarily common. In fact, studies show that more than 70% of adults over 65 have hypertension, and the frightening statistic within that statistic is that a significant proportion of those people have what we call uncontrolled hypertension, meaning their blood pressure is not consistently within a safe range despite medication. Why? Because medication adherence is difficult, because blood pressure fluctuates, because life happens and doses get missed, because many seniors live alone and nobody is watching, and because the symptoms of dangerously high blood pressure are so often mild or absent that people simply do not know they are in crisis until something catastrophic happens. Gloria, the woman I told you about at the beginning, did all the right things. She sat down. She took her medication that she had skipped that morning. She called her daughter. She did the breathing. She measured again after 10 minutes. 179 over 118, still dangerously high. She measured again at 20 minutes. 171 over 112, coming down, but not enough. Her daughter arrived and drove her to the emergency department, where she was treated, monitored overnight, and her medication was adjusted. 2 days later, Gloria was home, safe, her blood pressure under better control than it had been in years. The doctor who treated her in the emergency room said that if she had gone to sleep that night without acting, which is what many people in her situation would have done, she may well have had a stroke in her sleep. I want to tell you about what happens when people do not act, because I have seen it. I have sat with families in hospital waiting rooms, and I have had the conversation that nobody wants to have. A 68-year-old man who measured 190 over 130 one evening, dismissed it as stress, went to bed and woke up unable to move his right side. A 74-year-old woman who had a hypertensive crisis during a family argument felt dizzy, laid down to rest, and her family found her unresponsive an hour later. A 79-year-old man who knew his blood pressure was high but hated hospitals and decided to manage it himself with deep breathing alone, and died of a hemorrhagic stroke 3 hours later. I am not telling you these stories to frighten you without purpose. I am telling you because every one of those people, if they had acted immediately, would very likely be alive and well today. The action exists, the knowledge exists, and now you have it. Let me talk about prevention, because the most powerful thing is to never reach 180 over 120 in the first place. And there are 5 things that Dr. Kami William wants every senior to be doing consistently that dramatically reduce the risk of hypertensive crisis. The first is medication consistency. If you are prescribed blood pressure medication, take it every single day at the same time. Set an alarm on your phone. Use a pill organizer. Ask a family member to check. Missing doses is the single most common trigger of hypertensive crisis in patients who are otherwise managed. The second is home monitoring. Every senior with hypertension should own a home blood pressure monitor and know how to use it correctly. Measure at the same time every day, ideally morning and evening, sitting quietly for 5 minutes before measuring, feet flat, arms supported at heart level. The numbers you measure at home are often more reflective of your true blood pressure than readings taken at the doctor's office. The third is sodium reduction. Excess sodium is one of the most powerful drivers of elevated blood pressure in older adults. The kidneys become less efficient at excreting sodium as we age, meaning the effect of high-salt diets becomes progressively more dangerous after 60. The target is less than 2,000 milligrams of sodium per day, roughly 1 teaspoon of salt. Reading food labels, choosing low-sodium options, and reducing processed food consumption makes an extraordinary difference. The fourth is consistent, gentle physical activity. Walking 30 minutes 5 days per week has been shown in multiple large studies to reduce systolic blood pressure by an average of 5 to 8 millimeters of mercury, an effect comparable to one blood pressure medication, not running, not intense exercise, walking consistently every week. And the fifth is stress management. Chronic psychological stress is a powerful and under-recognized driver of persistent hypertension. Meditation, prayer, gentle yoga, time in nature, time with people you love, these are not soft suggestions. They are cardiovascular prescriptions. Before I close, I want to give you the one thing that I believe matters more than anything else I have said today. It is this: know your numbers, write them down, carry them with you. Tell your family what your blood pressure target is and what number means call an ambulance. Because the difference between a hypertensive crisis that ends in full recovery and one that ends in permanent disability or death is almost always the speed of response. And the speed of response depends entirely on whether the person experiencing it or the person beside them knows what they are looking at and what it means. Gloria is 73 now. She measures her blood pressure every morning and every evening. She takes her medication at 8 a.m. and 8 p.m. without exception. She has a note on her fridge with the numbers that mean sit down and breathe, the numbers that mean call her daughter, and the numbers that mean call an ambulance. She has not had another hypertensive crisis in 2 years. She told me at her last appointment that she wishes she had known all of this 20 years earlier. She said, "I had no idea a number on a little machine could mean the difference between life and death." Now you know, and now you can make sure the people you love know it too. Share this video, put it where someone who needs it will see it. And if you have not measured your blood pressure today, go and do it right now. Your life may depend on knowing that number. I am Dr. Kane William. Please take care of yourself. You matter to the people who love you, and you matter enough to act.